It's my pleasure to be visiting with Dr. JaDean Anderson, who is a chiropractor, and he's filling us in on chiropractic. Dr. Anderson, who needs to see a chiropractor?
I would say anybody that's wanting to make sure that their body's functioning at 100% and they're able to be as healthy as they truly can be.
So it's not necessary to just, you've got an ache or a pain somewhere in your neck or your lower back or mid-thoracic?
No, the premise behind chiropractic is restoring nerve flow to the entire body, and sometimes when you have a symptom, it's the last sign as to that there's a problem. So just because you don't have back pain doesn't mean that there might not be an underlying problem that is affecting your body.
Then you would suggest coming in for a tune-up.
Yep. Well, I call them oil changes in my practice.
Yeah, you do.
Yeah, where basically you just need to come in and get checked to see if you need an adjustment, and if you do, we adjust you. If you don't, we high-five each other and send you on your way.
What would be some of the symptoms that would tell you that you need to come in for more than just a tune-up?
I would say the common symptoms that tune patients into coming back in for an adjustment are the original symptoms that brought them in to begin with the first time. Well, that could be the mid-back pain, the low back pain. Lots of times patients that have headaches have trigger events that are letting them know that they're about to get a headache in the future. Things such as that are good signs or indicators that you need to come in and get fixed. Lots of times I tell patients that the first sign that you believe that you might be going down the road that brought you in to begin with, to try to come in as soon as you can so we can get you fixed before you have the severe headache or the severe low back pain that you came in originally for.
So you would keep coming back in if you had those symptoms?
Yep.
But a lot of times they would be cleared up, right?
Yep, and lots of times a patient comes in and I do my chiropractic workup on them and find that they don't need an adjustment, which is just as good, and we can send them on their way and be happy about it.
But it's not necessary for everyone to come in and have an adjustment, right?
It's not necessary to be adjusted every time you come in, no. The best way to know whether or not you need an adjustment is to have your chiropractor do the workup that they do to find out if you need an adjustment. There's been many times where a patient has come into my office and I have not adjusted them. I check them and decide that it's best to not adjust them.
Oh, very good. Well, thank you, Dr. Anderson.
You're welcome.